Hampshire, okay, just about 40 minutes north of Boston. And I have an aesthetic practice, but also a sexual wellness practice. So I like to tell people I'm a recovering internist. That's basically what I am. Sold my medical practice in 2009 and have an exclusively non-surgical aesthetic / sexual wellness practice. So it was about 2015 when I actually trained under Elizabeth Roy in PRP injections. And that's how I hooked up with Jill Swartz. And have been doing those since then, both P shots and O shots. And also a couple years after doing it myself, started training other physicians in terms of how to perform the injections. So I was fortunate in the beginning to have started with the M-Site system with a high volume draw. I mean, a lot has been said about, you need a certain amount of blood, to hit that number. And you'd be surprised, and this has hit me over the head many times as an instructor, really intelligent doctors, really intelligent doctors, brilliant doctors, not thinking back enough steps to really get that until you point it out. So I was asked last October to train some docs in Montreal. This is a good little sort of vignette. It was actually a urology practice in Montreal, and they were starting a sexual wellness clinic, wanted to incorporate also medical spa procedures, but definitely PRP, and so they brought me up there to do a 2-day training. So they had a gel separator kit with little 10 ml tubes. And so I'm, giving the lecture and explaining to them, platelet counts and how much blood to draw. And they're kind of looking at me like, really? I'm like, really? And I'm, explaining, I'm like, listen, do the math. Just do the math. What's the average platelet count? How much of the blood is platelets? How much is red cells and other constituents? You're going to realize that if you're only doing a 20 ml blood draw, you're not going to get 1.5 million platelets per ml. It just, unless you have a magic wand, So the second day of the training, a rep shows up from the region company, and to show them their newest, latest, most efficient tubes that's going to get them 7 mLs of true PRP. And there I am in the room with one of the urologists and the region rep, and he can only speak French, okay? And I can't speak French. And we're having an argument. I'm having an argument with a man who can only speak French, and I can only speak English. And he's trying to tell the doc, well, my tubes are so efficient that you're going to get enough PRP. And I'm telling him, I don't care how efficient your tubes are, you're not drawing enough blood, in 2 tubes to get enough. So there really is an incredible need within this field. I mean, before PRP gets, commoditized, right? Like laser hair removal or something, like everybody's doing it, it's all the same. We can't let that happen, okay? Not all PRP is equal. We have to hold ourselves to a higher standard. So, having been, I think ultimately in Montreal I got my message across. I hope I did. I don't know how many tubes these days they're doing. I haven't asked. But the more I teach, the more, this comes up. So I had gone down in Massachusetts to a 1-day conference at a place that was doing stem cell harvesting from fat, abdomen, etc. And as we're, walking around this, big, huge production, I see on a counter, a platelet counter. And I'm like, whoo, a platelet counter. I need a platelet counter, right? So how better to deliver the message, right? And how better to, show people you're instructing, look, here's the platelet count. Here's the platelet count of the PRP. Then if you have the machine that counts the platelets, which you, had brought up. So it was February, actually, when this was probably the 3rd time I was Googling platelet counters and where was I going to get my platelet counter from, that I hooked up with Tapley Holland, who's in the back of the room there. And his email back to me was actually on February 28th, which will forever be our Gmail, date, right? That's our Gmail anniversary, Tapley. And he said, you want a platelet counter, and I've looked at your website, and we need to do more together than me getting you a platelet counter. So as luck would have it, Tapley and his team and Connie and at Bridging Biosciences was already 8 steps ahead of me fortunately, in saying there needs to be a standardization here. We need to be determining at the point of care, what is the platelet count of that patient that day? And having a software that will take that platelet count, take into account the system you're using, be it MSite or whatever it is, they can program in any number, take into account how many milliliters of true clinical PRP do you want for your procedure, because that may vary. Maybe you want 7, maybe you want 10, maybe you only need 2, maybe you need 5. Based on the system you're using, the patient's platelet count, how many mLs of PRP you need, that software tells you how much blood to draw. How cool is that? Okay. We're taking it a step further, though. We're listening to the software, we're drawing, the appropriate amount of blood. We're then testing the PRP before injection to document what the dose is that's being delivered. So essentially, and I'm not even sure if I know how to make this go ahead. Is this, it's this one? Okay. So we're trying to answer all the right questions, right? It's PRP quality control. And that's what we are, and as soon as I saw this, and as soon as I was, talking to Tapley, I said, you need to talk to Jill. And I hooked them up by email. I said, this has to come together. This is very powerful, what we're going to be looking at. We have called it the Transcend PRP protocol. Transcend, of course, meaning rising above, taking something to the next level, taking it beyond, the norm. So we are, again, doing a pre-draw determination of the platelet count for the patient on that day. Our dose that we're targeting is 1.5 to 2 million cells per ml. We're validating after the centrifugation process, and I'm using the MSite system, which I've always used for these procedures. So we're retesting. We're testing the PRP before we inject to document the dose that's delivered. So we're verifying the dose prior to treatment. We're customizing it to the patient, and we're delivering a certain standard of care in terms of doing that. What we found, just out of interest, we've only been doing this for I think maybe 6 weeks, would you say? 6 weeks, 33 cases, so that gives you some idea of, our volume of cases here. Interestingly, the average calculated aspiration volume, according to the software, has been 77.4 mLs, if we want to deliver the dose, that we want to give. So 88% of the time we're using a double kit, an MSite double kit. Now fortunately a double kit only costs us $40 more than a single kit, so that's nice. It's not a big deal to us. But this was a surprise to me, because we were always, before this, only using the 60 ml MSite kit. So this is going to be very interesting going forward. I will not say that we have not had success doing 60 ml kits in the past. We have any number of true home runs, cries, tears, women hugging us, I'm not saying we necessarily and everyone have to hit that goal. People do respond to less. But for the purpose of the study that we're doing, and this is an IRB study that's being initiated, we're holding ourselves true to the 1.5 million because we need a number. So the average baseline platelet count in these 33 people was 165. The amount on average that the software told us to draw was 77.4 mLs, so we would do a double kit. The software is also capable of telling us, if you then test your PRP before injection, and let's say it's 3.5 million cells per ml, the software calculates how much platelet poor plasma you need to add back in order to bring it back down to 1.5. So we're tweaking it to keep it at 1.5, which is pretty cool. And we're going to see where this goes, because we're doing outcomes measures with the IIEF, with the Female Sexual Function Index, and I think multiple studies are going to come out of this. But I feel very fortunate in terms of literally, stumbled across this, stumbled into Bridging Biosciences, and we're very excited. This will be a multi-centered IRB-initiated study. Bridging Biosciences is recruiting additional sites if anyone is interested. We are site number 1. But I think up to 10, maybe. And so what we've learned, maybe there's an 88% improvement opportunity, right? Maybe in the men and the women who responded so-so, or didn't respond, or needed multiple procedures, maybe we could have hit the target if we had been testing from the beginning and drew enough blood and delivered, a therapeutic dose. We're going to find that out. We're also, and this kind of scares me, we're going to send a survey out to everyone we've treated since 2015, to see how they did, to see where they're at, to see if it's been more than a year, why haven't they come back, that sort of thing, to have something to compare to, like how well did we do before we were testing, just in general. And then we'll see going forward, how well do we do now that we are testing, now that we are standardizing, now that we are having them do, absolutely a symptom survey, at 3 weeks, at 3 months, at 6 months, at 12 months, and able to follow that score longitudinally over time. How well are they going to do now that we know exactly what dose they received? So this is very exciting. Hopefully there will be other people in this room who are interested in participating in this. And I'm happy to take any questions.
Just curious, what hematology analyzer are you guys using?
It's Tapley, you want to speak to the exact device?
It's called a PC100.
Yep.
Only counts platelets, it's not a CBC.
Okay. And you guys aren't quantifying neutrophils?
Nope, it's a straight, it's a straight platelet count. Yep, it adds about a half hour to the whole process. So we've allowed for that, in our scheduling. We're bringing people in a half hour sooner because they have to do the finger stick first. And there are 2 wells that needs to go into, after it's been mixed with a reagent, and then it takes the platelet counter a certain amount of time. I think it's about 5 minutes to determine 2 different readings from 2 different wells, and then average the total, and then that number goes into the software, which already knows, we plug in, I'm doing a P shot, I need this number of mLs, here's the platelet count, and the software tells us how much blood we need to draw.
Are you guys attaching that data to your patient outcomes so you can kind of correlate?
Exactly. And the software is actually being set up. I mean, literally, the software is in development. I should say this, we're kind of tweaking it together, but it's being set up to follow the outcomes as well. But the current IRB study is about the counting. Correct, Tapley. It's not about the outcomes yet. That will be a future study. But the current one is about counting.
Right, you can start and asking the right questions and then progress from there. Kind of just recalibrate the environment.
Yes.
2 questions. When the patient, before the O shot, is asking you, I'm sure you've heard it all the time, how long is it good for? And the second question is, in the patient that had the O shot and had no response, let's say within, weeks, you offer them a second O shot.
Well, there's a lot of our women who are doing a combination procedure. So we have the Genevieve RF device. So we do a lot of what we call Genio, Genevieve plus O shot. It's not the turkey. But we generally tell women on average every 12 months to answer the question. I do find that women who do the combination procedure, who do the Genevieve, RF plus the O shot, usually at the 12 to 15 month mark, they're noticing a little bit of a drop off. They're not back to square one, by any means, but they're noticing it's not as good, and they will come back, for another treatment. Now we are, going forward, going to sort of split these groups out. In terms of future studies into O-shot only, Genevieve plus O-shot, Thermiva plus O-shot. We've got Thermiva 2, P-shot with, a pulse wave. We call it pulse wave, shock wave, low intensity shock wave. We'll get there. We have all of those patient types. The other thing I will mention, and I think it's good for you to consider too with respect to this is, because in my head it's always the marketing thing, right? The marketing thing, how to communicate, not marketing sell, but marketing communication. How to tell your patients that your PRP, is a higher quality, right? How do you do that? How do you convince them that your procedure is a higher quality than somebody who's doing it for half the cost and using a gel separated tube that costs them $90 or that sort of thing. So we literally just this week, as in like yesterday, got the web page up for this Transcend protocol on our website, and we are going to be very forthright with with our patients to say, look, we're testing. We're testing. That's how we know the quality of our PRP. So if you're thinking of going somewhere else, ask them if they're testing. Or what system are they using? Ask them how much blood are they drawing, right? Because we can tell you right now, if they're doing a couple little tubes, that's not enough true PRP probably to deliver the adequate treatment. So it's also about educating the consumer to ask the right questions and to understand that not all PRP is created equal, and that there are differences that have to do with more than just what street you're located on or what city you're in or everything else. So I think we will be able to educate them. We will be able to point out to them that knowing the dose is important, and I see that as the future. I think we're going to raise the bar, honestly, in PRP, and we're very excited to get some of these studies done and really, put it on paper. This is the volume we need. This is the dose we delivered. This is the success we had. Match it, right? Match it. So that's where we're at in little New Hampshire. Right?
And if I can add to that too, I think this is where we are as a group here to move this forward so ethically and responsibly. So let's not forget it is a business, absolutely. We are in business, but we are in business to progress this in the most efficient, effective, and ethical way. So I'm so humbled by your presence here and sharing this information and allowing me the platform to create for you all. And you all should be privileged to be able to get this information because you can't get it anywhere. So I want to promise you too that we're going to continue this conversation. This is what this is all about, bringing new ideas, new topics. I actually have a questionnaire in all of your folders. I mean, it might take a